So regarding a poster on metaplastic triple-negative breast cancer, really the intention of that study was to understand if metaplastic triple-negative breast cancer has a distinct molecular and immune phenotype compared to invasive ductal triple-negative breast cancer, which it's commonly treated as because of lack of specific trials for metaplastic patients. So we performed whole transcriptome sequencing and next-generation sequencing for about 91 patients with metaplastic triple-negative and compared it to 364 patients with invasive ductal triple-negative breast cancer. The vast majority of these patients were female, but we intentionally did want to look at some racial differences as well. So in our cohort of metaplastic triple-negative breast cancer patients, about 66% of patients were Caucasian, about 20% of patients were African American, and about a little over 4% of patients were Asian or Pacific Islander. When we looked at the mutation profile, the common mutations that were seen differentially higher expressed, metaplastic triple-negative were those that are consistent with what we've seen in literature, such as PIK3CA, PIK3R1, EGFR, TERT mutations, and PTEN. We did see a higher proportion of P53 mutations in these patients, but it was not found to be statistically significant compared to invasive ductal triple-negative. And when we looked at the racial ethnic disparities, we didn't see these mutations enriched in one racial patient population versus another. We also looked at immune markers. So when we think about immune checkpoint inhibitors, we look at markers like PD-L1 status, tumor mutation burden, microsatellite instability, high status. And these were not statistically different between the two groups, although the incidence of PD-L1 positivity by 22C3 clone, which is the companion diagnostic for immune checkpoint inhibitors, pembrolizumab, was about 50% of our patients. So certainly setting the stage of considering immune checkpoint inhibitors in this rare and aggressive subtype. And we looked at immune cell infiltration, so we performed deconvolution of whole transcriptome analysis and found that metaplastic triple-negative has a higher expression of M2 macrophages and neutrophils that tend to create a more immunosuppressive microenvironment. There was no difference between MHC class 1 and class 2 genes, and there was a differential expression between stem cell-related genes, apoptosis, cell cycle genes, suggesting that it truly has a distinct biology and a testimony to its aggressive nature and hard to treat phenotype. So that was essentially the results of our study. As next steps, we're performing GeoMX, which is spatial transcriptomics, on metaplastic triple-negative breast cancer patients, comparing it to stage-match triple-negative invasive ductal patients to see if there are novel signatures or targets that we can then therapeutically leverage to determine new treatments for these patients.